to know about how we use gabapentin and pregabalin to treat dog and cat anxieties, fears, and phobias. Get ready for the gabapentin pregabalin deep dive. Gabapentin and pregabalin are in the same family of drugs. They aren't identical. Pregabalin is going to be considered a second generation GABAergic medication. That doesn't mean it's necessarily better for your dog or cat. It just means it's the next iteration of drugs in that drug category. You know, pregabalin and gabapentin don't directly affect GABA. They don't even look like GABA, and they don't bind at the same binding sites, but they do have this general effect of calming and pain relief. Matter of fact, in human medicine, gabapentin and pregabalin are used widely for pain relief, and they're both used for general anxiety disorder in people as well. Now, in dogs and cats, we're going to use them for pain relief for sure, but we're also going to use them for fears, anxiety, and phobias. You can use them daily for the long term, or you can use them acutely, meaning just for storms or just for fireworks, car rides, or vet visits. Gabapentin and pregabalin have about the same effect in that they will decrease anxiety if they work for your pet. They may increase appetite as well, and at high doses, they may cause sedation. But even then, they're not the best sedatives in the world. Both of them have very similar side effects: sedation, ataxia, which is like wobbly walking, and also that increased appetite. Now, keep in mind, whenever you give your pet a medication that could alter mood, it could alter mood in a negative way. So you're always going to keep looking out for signs of agitation or negative changes in your pet's behavior, regardless of what kind of medication or supplement you are using with. So which one's right for your pet? Gabapentin, pregabalin, or neither one? I have no idea, and nobody else does either. Sorry. The way that these psychiatric medications exert their effect depends a lot on your pet's genetics and their metabolism of the medication. But there are some guidelines that we can probably follow. Now, gabapentin is best given 3 times a day, about every 8 hours. If you can't meet that goal, your pet may be better off with pregabalin, which is given every 12 hours. Pregabalin and gabapentin are mostly excreted in the kidneys, so to take either one, your pet has to have very good kidney function. Now, in dogs, gabapentin is 30% metabolized in the liver from what we know from the most recent studies, so we want to get a liver profile on any dogs that are taking pregabalin. But what about absorption? You can give pregabalin and gabapentin with food. However, you will change the absorption of gabapentin ever so slightly if you give it with food. Either way, I tell people it's okay to give gabapentin or pregabalin with a meal. What if your pet has gastrointestinal disease like IBD or IBS? If your pet has an inflammatory gastrointestinal disease, it can alter the way that gabapentin is absorbed, at least if we extrapolate from human research. In that case, you might want for your pet to take pregabalin instead of gabapentin. Gabapentin comes in liquid, in capsules, and in tablets, whereas pregabalin comes in capsules and in a liquid. Pregabalin is controlled, which means that your veterinarian has to have a DEA license, and the pharmacies where you are going to go and get that pregabalin are going to be very careful about how many capsules they dispense. So gabapentin is easier to acquire from the pharmacy, especially if your veterinarian is writing a prescription that is PRN or as needed. So you can see there's a lot of different things to consider when your veterinarian decides if your pet needs pregabalin or gabapentin. What it really comes down to is, can you give the meds every 8 hours or every 12? Does your pet have good liver and kidney health? Does your pet have underlying inflammatory disease in the gut? And can you give your pet a capsule, a tablet, a liquid, etc.? Then you try one and you kind of titrate up the dosing range, decide if it's right for your pet or not, and move on from there. Your veterinarian can help you with all of this. Your veterinarian may choose to prescribe them for an event like storms or riding in the car or vet visits. You're going to give the drugs differently based on what your pet is. For example, if we're using it for noise phobia, we might say to give the medication 2 hours prior to fireworks, but for vet visits, we might say 3 hours prior to the visit. So just pay attention to what your veterinarian is saying to you and what is on that label so that you know exactly how to give the drug. How you give it will affect how well it works. When they're prescribed correctly, they can absolutely help pets to feel better. It's going to be individual to your pet, so it's going to be that hit or miss. There's nothing that I can do about that. If your veterinarian doesn't feel comfortable with these medications, or maybe you think your pet needs a medication increase and your veterinarian's not comfortable, ask for a referral to a board-certified veterinary behaviorist. Just because there's not one within driving distance of you does not mean you can't get care. Almost all of us offer telehealth appointments. I know I do. So a veterinary behaviorist is no more than a phone call or a Zoom appointment away from you, and you can get a plan for your pet in as little as 48 hours. If your pet struggles with fear, anxiety, and phobia, these might be the right medications for your pet. Talk to your veterinarian.